Hey guys, welcome back to my YouTube channel. If you are new here, my name is Noko. Some call me Tapedi, some call me Neno. Anyway, this is such a random video. So today is a Friday, it's Heritage Day, and tomorrow is a Saturday, so I'm gonna be on call. So I just decided that maybe let me just shoot a video just to show you guys what I get up to randomly every time, like day before a call, or how I actually prepare myself for my calls. Guys, it's not just about me going on call, but I need to emotionally and mentally prepare myself, because nobody likes being on call, because it's a flipping 24 hours of you being at the hospital. So I kind of do stuff to make myself feel better about being there, especially this weekend. I'm kind of sad. Everyone else is getting a long weekend except for me, but at least I got today free. So what I got up to this morning, I actually went out for breakfast with friends. So now I'm just gonna drive to Brooklyn, buy myself a few stuff just to cheer myself up, and just buy a few stuff for call, because yeah, like I said, you need to mentally and emotionally and physically prepare for call. But yeah guys, so I'm just gonna take you guys with. I hope you enjoy, and if you enjoy, don't forget to give it a thumbs up, and also don't forget to tell your friends about my YouTube channel so that they can tell their friends. And yeah, if you haven't subscribed to my YouTube channel, please click the subscribe button below. Let's go. Did it not take me 5 days and 5 nights to park my car? Oh my gosh, Brooklyn Mall is so full. But also I understand, because it's flipping month end. So anyway, while I'm here, so I'm actually shopping for chairs. So I'm just gonna see if they probably have what I like at Rochester. And yeah, I've been shopping for this chair since February or something. So let's see what they got. One thing about me, I am indecisive. Yo guys, chairs are so flipping expensive. I literally just got in there, spent less than 20 seconds, and I was like, you know what, I'm gonna think myself through. So I'm just quickly gonna go to Starbucks. I think I want something cold. Oh, actually no, I'm gonna go to Woolies, buy stuff for cold, and then so I can chill at Starbucks. Hopefully it will still be open by then. But yeah, let's go. Adulting is the ghetto, so I'm by the bathroom section. I'm trying to get myself a new bath mat, and so far I could find this, but it's so expensive. What the fudge. Also, I thought I should just get myself a new bath towel. If you see me doing this, it's a sign that you need to change yours, please. Obsessed with body products, so I'm just gonna try this out and we'll see how it is on my body. Hope it leaves me all soft and whatnot. Also, yes, I'm not a baby, but I'm just gonna get myself these. So this is dairy, banana, and whatever. And which one should I try out? The apple. Love this for me. So I'm gonna use this as snacks. Anyway guys, you guys will see that I definitely love convenience. So tomorrow for core dinner, I'm gonna have mince curry and rice. And then for lunch, I'm gonna have this mini smoky beef barbecue sandwiches. So they're just very tiny sandwiches. And the rest are like snacks, smoothies to keep me going. Then I'm also gonna pack water and probably coffee sachets for when I get tired or hungry on call. So yeah, simple girl. finally going home. Actually, I'm gonna go have Starbucks first and then we go home. Anyway, how cute is my outfit? I'm wearing a cute little dress. And yeah, decided to have double gloves. Glasses. Wow, double gloves. Hectic.
And another woman that could take your spotlight. If I wrote you a...
Anyway, guys, I was thinking we could do a mini catch up. Oh, I hate the angle of the camera, but so far this is what we can work with. Shout out to actually people that actually gave me idea of my content, what I should do. So yeah, I'm at Starbucks now. As you guys can see, I ordered myself a cold brew latte. Excuse the lighting. I think it's that. Those two lights at the back are killing my vibe. But we move. So yeah, this is what I got. I don't know if I have to actually open the whole thing. I've never had their cold brew. But I'm just gonna probably... No, I don't think I have to. Give me a second. Anyway, what a mission. I'll figure it out. But yeah. Oh, it's quite nice, but I think I'm gonna put a bit of sugar in mine. Give me a second. Much better. So yeah, I wanted us to at least catch up. So I've been doing obstetrics and gynecology for the past almost 3 months now. It's almost coming to an end. And y'all, it's a very, very, very hectic, block or rotation. The calls, you feel them. Like if you're on call for 24 hours, you are literally awake for a full 24 hours because it's that busy. Like there's always someone delivering or some form of emergency, so you can just imagine. But other than that, I've low-key been enjoying it. It's definitely not something, some of you are gonna ask me if it's something I see myself doing for the rest of my life. Definitely hell no, because I really am a firm believer in having good quality of life, and I don't see that in obstetrics and gynecology. People that are actually there technically do not have a life. So yeah, hence I say I don't actually see myself there. But I hope you guys have been well. I'm actually just babbling. But yeah, I just wanted to catch you guys up on what I've been doing. You guys, I'm back at my place and I'm a bit shook. Like, road rage will never not shock me. So I was driving, right? Oh my gosh, I'm so bored. I'm so bored. This nigga I had the right of way, right? I don't know what the fuck he was doing, but he decided to pass when I was passing, and we almost smashed into each other. It's not even that deep, like not even almost, like I don't even know how to explain that. But he swore at me, like he literally swore at me. So I'm a bit shaken by that. I don't know what's wrong with people. I really don't. I realize I can never, even if I'm in those kind of situations, I can never, even if I was at fault, if they were at fault, I can never really bring myself to swear. Maybe I'm not at that level yet of driving where I literally swear at people. But yeah, anyway, I'm back at my place. I realized that when I was at Starbucks, I hope you guys heard. Let me try to hold this nicely. I hope you guys heard half of what I was doing. So anyway, the reason why I actually like obs and gynae is because nobody is too sick. Pregnant women are sick, obviously, but I feel like once you get their baby out, most of them go back to their normal self. So yeah, and also I don't want to lie, as much as I enjoyed it, pregnancy gave me a bit of anxiety. Number one, I feel like pregnancy is scary. It's so flippin' scary. It's flippin' scary. Nobody tells you that. All we usually see is nice people on Instagram posting themselves pregnant, born as shoots, and but they never really speak about what they literally go through. So in obstetrics, with pregnancy, the reason why I say it's scary, especially for me, it's scary because I am flipping turning 27 this year and I don't have a child, somebody would actually say, but you're still young, you still have time. Cutie, listen, I learned recently that the most ideal age for you to have a baby is 24. Apparently research says so according to my reg. So everyone, like, I remember we like usually talk with the rages, because also they also don't have kids, and they say that they actually sometimes also panic because the older you get, like as you approach your 30s, there are like so many risk factors. So many things can go wrong with your pregnancy. You can get diabetes, you can get hypertension during pregnancy, which are mostly dangerous not only to you but also to the baby. So usually, you know how people will be like, no, you can't have a baby when you're above 35 or 40 because of Down syndrome, and it's not even just about congenital abnormality, but it's also dangerous for your own body. So I saw a lot of ladies, either they were like probably very young, 20, 21, 22, or above 30, that usually presented to us with preeclampsia. So to briefly describe what preeclampsia is usually when you have a very high blood pressure. I'm just simplifying it. Very high blood pressure and protein in your urine, or sometimes you can have like organ failure. I don't know if I'm making sense, but also it can lead to eclampsia, which is you having seizures during your pregnancy. So the only way to actually treat that usually is to take out the baby, especially, yeah, that's definite treatment for it. But obviously there are other medical interventions that we can use, but they don't always work. But anyway, just Google preeclampsia and eclampsia just so that you don't listen to my lies. But you can imagine, like, it's very dangerous. So it gave me a bit of anxiety because I'm not in a rush to have a child, but sometimes when you think of those, especially if you work in an environment where you see a couple of people actually suffer from those, it can be quite scary. So yeah. And then another thing in gynecology, biggest highlighted thing for me was cancer of the cervix. So for those who don't know, cancer of the cervix is actually caused by the HPV virus, and the HPV virus is usually transmitted via sexual intercourse. So most males are actually carriers. So there are vaccines against HPV, and usually they try vaccinate naive young girls. Like, I think in South Africa, we probably try vaccinate them at the age of 9 in order to prevent CA cervix. Because what sucks, I realized with most patients that who have CA cervix, like, it's really bad. Especially we usually find it when they are in the end stages and there is nothing much we can do. So I got my pap smear. So I don't know if the guidelines have changed but from what I remember, the moment you are 25 years old, you need to get your pap smear. So that, you know, a pap smear is actually a screening tool in which we check whether you have cancer or abnormal cells down there, so that we can do something as quickly as possible. So yeah, if you're 25 and above, if you haven't gotten your pap smear, please kindly go get your pap smear done. And if it's normal, go get your vaccine. I'm working towards actually getting my vaccine, although I'm a bit, it's discouraging because it's apparently very expensive. So I'm hoping my medical aid will probably cover that. And I don't know actually if government facilities offer vaccination, but I'll try find out. But those two things were what's been highlighted to me for the past 2 and whatever months or weeks. So yeah, but otherwise I just enjoy the fact that towards the end with pregnancy, you have your baby, it's beautiful, you deliver, it's just beautiful. And another interesting thing, or one thing that made me enjoy it, is that they let you deliver a baby by yourself. So I cut a few cesarean sections, and the first one I cut, I was so confused as to, you know how I'm always on the other side assisting. So when you assist, it's different when you are from like the other side of the table and you're the one actually doing the procedure. So shout out to all the regis and the consultants who make it look easy. When I did it, it was flipping difficult. I couldn't figure out where to cut. Like, I was just so confused, and I got lucky that the baby that I delivered was so small. They were like a 1.8 kg, so that was very tiny. So I had to be very gentle with them when I had to take them out, but it was beautiful getting a cry out of them. So yeah, guys, obs and gynae is fun, but like I said, I wouldn't do it. These people work so much, like work hard. There are calls where when I got home, I couldn't believe that what the hell did I just work that much. And usually with these calls, I'd come back home and pass out. I would literally pass out on my bed, and because usually I'd come back from call around 9 a.m. in the morning, and I'd sleep till like late in the evening around 7. So that's how exhausting calls are in obstetrics and gynecology. So the way they've been so hectic, I promise you guys, I'm definitely gonna celebrate on my last day, or my very last call. I'm celebrating because I never thought I could push myself to work as hard as I did this past 3 months. Like, I couldn't believe it. And you know what's funny, I started actually like questioning myself, am I lazy? Oh my gosh, I can't believe my body is working this much. But I pulled through, and most of all, I prayed. I asked God for the strength, because at one point I was like, God, I'm literally struggling with this. But God pulled through, you know. And I had the nicest registrars, like I had the nicest senior doctors. They were always willing to help, and they were so, I don't know, you know when somebody's within their speciality and you can see that they're loving what they do. So also that pushed me to also want to work hard, because I saw everybody around me was working hard to make sure that the patient is fine, the work is properly done, and but yeah, just wanted to be brief about that. Anyway guys, I don't know if I think I should probably close my video here. Thank you guys so much for watching. So basically the whole point of this video is that before my call, usually even if it's during the week, I'll probably drive to a Woolworths or a Pick n Pay or a Checkers to go buy a few things that I probably might need for call. I didn't buy some of the stuff like Powerade, juice boxes, because I already have that. I usually stock that every time month end. So yeah, so usually in my call bag, you guys need to see, I think I've once showed it on my Instagram, what I carry in my call bag. I'll have my call snacks, my food, and water, lots of water, because you need to stay hydrated. But yeah, if you didn't see me buy those things, because I already have most, like the water and but yeah guys, I'm just gonna now go to my place, wash my hair, watch TV, just wait for tomorrow. I'm gonna probably sleep early. I try sleep early day before a call, because I'd hate being there tomorrow morning and I'm already sleepy and it's only in the morning, and I have a full 24 to 26 hour shift or whatever. So yeah, I'm gonna end it here guys. Thank you so much. Thank you so much for watching. Don't forget to give me a thumbs up, and don't forget to subscribe if you haven't subscribed. So to shooting more content, to having more content ideas, don't forget to suggest as to, like, down below or in my Instagram DMs as to what you'd like to see more on my channel. And love you guys. Thank you for the support.